Summit guests, please welcome to the stage today's MC from WRTV Indianapolis, Rachael Wilkerson.
Good morning, everyone, and welcome to the Business of Mental Health. We're so excited that you could be here with us this morning, and you look phenomenal, by the way. So let's just give you all a round of applause for being here this morning. This event is presented by the Indiana Mental Health Roundtable in partnership with the Indiana Chamber and Wellness Council of Indiana. Together, we're bringing business-minded leaders from across the state to share ideas, learn from one another, and focus on what it means to prioritize wellness in the lives of Hoosiers. I'm WRTV's Rachael Wilkerson, and I'm thrilled to be your MC today. Thank you so much for having me. We have an incredible lineup ahead, speakers and panelists who are helping shape how we think about mental health in the workplace and beyond. Today is all about conversation, connection, and finding new ways to turn awareness into action. So I encourage you to take time, ask questions, that's what we're here for, and meet people around you. We're all here because we care about building a healthier, more resilient Indiana, and it starts with gatherings like this. But before we get started, we have a few housekeeping notes. Restrooms are near the main entrance to Gridiron Hall, that's right by the registration area. We have a few breaks built into the day, and of course, everyone's favorite, the lunch buffet. We will have that available later this afternoon. But feel free to get up as needed. We have coffee, soda, water. All of that's available in the back of the room, so don't be shy. That's here for you. And we also want to take a moment to thank our partners and sponsors who helped make today possible. Our Alley sponsors, Bethany Legacy Foundation, Herbert Simon Family Foundation, and Riley Children's Health. Can we give them a round of applause? Our community sponsors, Lucas Oil and Valinos Foundation. Round of applause for them. And finally, our friends of the summit, Arvin Sango Incorporated, Calcom Indiana, Girl Scouts of Central Indiana, Madison Mission Incorporated, Morgan Family Endowment Fund, and Professional Firefighters Union of Indiana. Thank you. Your support and commitment to advancing mental health in Indiana truly makes a difference, and we could not be more grateful to have you with us today. With that, I would like to take a moment to share why this topic is so meaningful to me, and so you can get to know me just a little bit. Not only is it cool to be here in the Colts facility, right, with everything going on in the season that they're having, but in 2021, I lost my mother unexpectedly. I was living in Mobile, Alabama, working as an investigative reporter, and I was at work when I got the phone call that my mother passed away. She was 47 years old. The coroner thought there was nothing in the house, probably natural causes, but it didn't seem right to me. So, being the investigative reporter that I am, I pulled surveillance video from the house and created a timeline and literally investigated my own mother's death. Come to find out, she died from fentanyl poisoning, but we had the video and the timeline. I turned all of that over to the DEA and started that. But that took a toll on me, right? I mean, I'm working in news, I'm sharing people's stories, and at the same time, I'm investigating my own mother's death. But it was important that I had a boss and a support group around me to help navigate that. Like I said, was in Alabama. I had an opportunity to come to Indianapolis and be closer to my family. My mother was in Portage at the time. I had other offers from other outlets here in Indianapolis, but I chose WRTV because they said to me, your mental health and your family comes first. Well, that sold me right there. I'm going to Channel 6, sign me up. So I went to Channel 6 and I would tell them, hey, I need to take a mental health day today, or I can't cover this homicide today because I can't hear those families cry today. And so they really have prioritized our mental health And that is just so important in the workplace. They say, we've got you, it's okay. So I know you see the headlines every day. Sometimes you might not see them because you don't have the apps on your phone because you don't want to see them, and that's okay. But news can be heavy, so finding ways to navigate and to cope and to talk about those things have really helped me along my journey. I've learned how to find that work-life balance, but I could not have done it without the help of my managers. So I really wanted to share that so you could understand why your role is so important and just vital to your employers, or the ideas of helping navigate that journey for someone. So thank you for that, for allowing me to share my story. I didn't take up the full 10 minutes. Sorry, Ann. But now it is my pleasure to welcome someone whose leadership has been instrumental in driving the Roundtable's progress, Indiana Mental Health Roundtable co-chair Ann Hazlett.
Thank you, Rachel, and good morning, everyone. It is just an honor to have you today. On behalf of my co-chair, Marv Richardson, and the entire Indiana Mental Health Roundtable, I want to begin with extending a warm welcome to each of you. We are truly grateful that you have given your day and your time to be part of this important conversation. The Indiana Mental Health Roundtable was founded in 2021 by Lieutenant Governor Suzanne Crouch and former Lilly CEO John Licklider. And in founding this organization, there was a strong recognition that mental health is a critical issue for our state, and that making lasting change in this area of healthcare will take a strong partnership between the public and private sector, which is why many of you are here today. At its core, the Roundtable is built on relationships, people and organizations coming together with a shared purpose and a belief that collaboration can drive real and lasting change. As we kick off this day that we hope will be filled with learning, networking, and inspiration, we are especially grateful for our partners at the Indiana Chamber and the Wellness Council of Indiana for helping shape this year's summit. In particular, we want to give a heartfelt thanks to our event co-hosts, Vanessa Green-Cinders and Jennifer Fair, for their leadership and their vision in making today possible. We also want to recognize the Sagamore Institute. Sagamore serves as the home of the Indiana Mental Health Roundtable, and they have really provided the resources and the staffing to set that foundation that allows this important work to grow and thrive. And lastly, want to thank the Indianapolis Colts. The use of this facility and their leadership and using their platform to raise awareness about the issue of mental health. Thank you to the Colts. Our theme today is the business of mental health, and that really captures a truth I think that we in this room know that we can no longer afford to overlook, and that is that when we invest in the well-being of people, we strengthen our workplace, our communities, and ultimately our state. For many of us, this topic is deeply personal. Perhaps it's personal for you or for somebody that you love in your family or in your workplace. It takes courage to have these conversations. It's creativity to find solutions, and it's collaboration then to move those solutions forward. And it's these qualities of courage, creativity, and collaboration that are embodied in our keynote speaker this morning. Bryan Mills is the president and CEO of Community Health Network. He's dedicated nearly 4 decades to community, began his career there in 1985, and then stepped into the CEO role in 2009 after leading Community's for-profit affiliate, Visionary Enterprises. He is a proud graduate of Ball State University, and he has been named multiple times to the Indianapolis Business Journal's Indiana 250 list. This is a list of the state's most influential business leaders. Under Bryan's leadership, Community Health Network has grown to become the most comprehensive behavioral health care system in Indiana. And earlier this year, Community earned the Bell Seal certification from Mental Health America, and they did so at the platinum level, which is the highest standard for workplace well-being that a company can earn. I think this dedication, this distinction is not just a badge of honor. It's a reflection of leadership and a culture that puts people first. As a healthcare leader, an employer, and a fellow Hoosier, Bryan understands the urgency of making mental health a priority. Bryan, want to thank you for your extraordinary leadership on this issue and for lending your voice to our conversation today here at this year's summit. And with that, I will turn this over to you. Would everyone please welcome Bryan Mills?
Hey, good morning. Pleasure to be here. I think Ann talked a little bit too much about me. This isn't about me. This is about leadership. And what I mean by that, when you think about addictions, mental health, or anything else related to that, I'm a very faithful person. I believe that I'm in the role I'm in for some reason. Never, ever thought I'd be in healthcare. And a little bit of my story getting into healthcare was I was an accountant by education, worked for a large accounting firm that's now called Ernst & Young. My boss took a job at Community Hospital to be the CFO, asked 3 of us to come along. I was 24, and I said, what would I do? He said, well, they're building a new hospital in the middle of nowhere, we call Community North. You be the financial guy. And I said, I can't do that. I'm not capable. He said, you'll be fine. So that was a long time ago, and things have changed throughout that. When my predecessor, Bill Corley, who was a fabulous mentor to me as well, when he retired, I did not apply for this job. The board chair came to me and said, we didn't get your resume. And I said, well, I'm not qualified and I'm not interested. And they said, send in a resume. So I sent them one, and then they really ticked me off. They sent it back to me and told me I could do better. And I tell that story because somebody saw something in me that I didn't see myself. Just one other piece of that story that I tell all the time, because it's true, is that I'm about 3 weeks into my new role in 2009, and I called my mentor and I said, his name is Jack Heine. Some of you all may have known Jack. And I said, Jack, I need to quit. I don't know what to do. And he said, what do you mean? I said, I don't know my purpose. I have no purpose. I'm there. I'm talking to people. I don't know how to run a hospital. I'm not a doctor. I'm not a clinician. I cannot help anybody. What do I do? He said, pick me up on Friday. He wasn't driving then. We'll get down to George's and talk. And the core of my leadership came from a very short conversation. And I was whining about all the reasons why I needed to go quit. And he said, Bryan, I thought you coached all those AAU basketball teams and baseball teams and took teams throughout the country. I said, yeah, I did that, but that was for fun, and being a dad was wonderful. But what's that got to do with this? And he looked at me and he said, go coach your team. I said, what? He said, go coach your team. You can't cross that line. Build a culture with your organization that they know that they can do whatever they need to do to help patients, and you'll back them. And that's how this all happened about 16 years ago. What I find amazing, and we can talk about all things related to addictions and why this doesn't work and how we don't have enough of this or enough of that or anything else. But what it is, anything else that actually means something comes from passion, comes from determination. Don't tell me I can't. Matter of fact, if you do, I love that, because that's going to be one hell of a fight. What it is that I believe that all of us get in situations or get promoted or be appointed to many, many things. And I think everybody gets a little anxious about that as well. What we have to do is have the courage and the confidence to learn from others. Community's got 18,000 employees. I guarantee you 15 of the 1,000 of the 18,000 have better grades in school than I did. They have more certificates. They have all these other things that they've done I couldn't have done. So I acknowledge you're smarter than me. I know that. Let's see how we're going to take care of patients. And we go through and we try to make sure to say, what do we need? We need to have access quickly. You know, you talk about addictions, what we're talking about in mental health today, it takes courage to say, I need help. But when somebody says, you know what, I need that help, we need to get them. I have personally driven people to our facilities. I've called people to help. I've been in a couple of times I probably shouldn't have picked these people up, but I did. And I didn't really think I was going to get there based upon what was going on in our car. But that's what it's all about. Fairbanks Hospital was founded back in 1945 down by Methodist. And in the early 80s, it was moved to the North Campus. So the Fairbanks Hospital Recovery Center now was there before Community North. And as I don't want to be negative here, but just the way in which finances work for addictions, mental health, and recovery, you know, there's not a whole lot of money there. So we acquired Fairbanks Recovery Center during all of our favorite times during COVID. Here's an organization that was doing wonderful work, but they literally did not have any money. And we said, let's do this. I tell our organization because that facility sits there, and it's a road between the recovery center and our behavioral recovery hospital. Until we actually did this transaction, you would have thought that street was 100 miles wide, because it was like a competitive thing. And sometimes in healthcare, we get into competition. And when we do that, it troubles me because we're not putting patients first. So now we have one place to provide these services. And we do it together. And we work together. We create our own teams. You know, we've added to we now have residencies, we have fellowships. We're trying to do things to have more and more of what this is all about. A lot of times we get into this and it's a mission thing. Well, you know what? Not-for-profit healthcare should be a mission. That's what we're supposed to do. That doesn't mean you're a charity. You still got to figure out how to balance your books. I could also stand here for an hour and tell you the names of people who I have personally helped. I would never do that, of course. But if you had those names, you would go from a whole list of people you've never heard about, and then you'd go to a whole list of people that you have. When Jim Irsay and that family, said, we're going to, kind of get rid of the stigma. We're gonna make that go away. I just felt, this whole energy that somebody in that position has the guts, has the courage to say, this can happen to anybody. And it's true. But people can get through it as well. I find it so frustrating sometimes that when you have cancer, people run to you. When you have mental health and addictions, a lot of times they run from you, which is just not right. It's just not right. When you think about how it all works, you think about cancer, okay? So it's like if you have pancreatic cancer, we'll help you. But if you have lung cancer because you were smoking, then we're not. That's BS. And then you get into the workforce part of this. I don't have the exact numbers. I don't even know the numbers that I've seen are real. But when you think about people and our need for employees, our need to continue to expand what we're doing no matter what industry you have. We have a lot of people that we could actually turn into very successful people if we would just embrace their concerns. And whether that's depression, whether that's alcoholism, it's drugs, whatever it is, we can do that. We have so many people in our organization that are hands-on caregiver who are at the same time fighting this themselves. And that's where their courage comes from. That's where their purpose comes from. I still believe that there's a day when all of a sudden, this isn't about, these people and those people. It's about we. And that we as a society, we as a group of leaders here, have the courage to say, I have a problem, I need some help. My daughter or son has issues, and be able to take care of that. I've driven my own kids to Fairbanks. I've driven my siblings to Fairbanks. I flew in my aunt from Georgia. And my Aunt Christy was an amazing friend. My aunt, we're from rural Kentucky. Only this can probably happen. Then my aunt and I were the same age. So think about that for a while. If you just took a hands right now and say, what are the top named addictions programs or hospitals in the country? You could go through and think who those are. She'd been to all those. But when I finally said, Christy, please come to our organization, she said, wow, I've never felt so important. I've never felt love like I felt there. And I'm saying that not to praise community, but people can feel passion. People can feel, the idea of saying, I'm going to give you strength. I'm going to give you goals, and I'm going to make sure you get those goals. And then when people pass that on, we get stronger. We have all kinds of careers, jobs in any industry that we need filled. When you talk about the business of mental health and addictions, I just think that this is overlooked. This is something that we have an opportunity to change our employment base by really caring for people and not just pushing them aside because, they can't do this or they got that problem or you're not reliable or whatever it is. It's so easy to look at people and try to say, okay, let's size each other up. I hope what we get from today is an understanding that this is something that we can address. Not just everybody in the room, but when we talk about what we're doing for education, what we're doing for career changes, what we're doing to actually have people have purpose in their life, and at the same time have the ability to help others. I just came back this week we're a partner with MD Anderson for cancer. And it's a really interesting thing because I didn't know, I actually cold called them out of a desperation point about 10 years ago. I was so ticked off on what was going on in oncology at Community. That's a whole nother story. But I called, and I didn't know that they were just a department of the University of Texas. I didn't know that. I also didn't know that they cannot own facilities outside of the state of Texas. So they put together this program to take all their knowledge, all their wisdom, all their results, all their research, and find organizations that will embrace that and deliver it. So I said, well, I'd like to be a part of that. So now there's 6 of us in the United States. There's also ones around the world. So last week we spent 3 days going through, and fortunately there's scientists down there, not just babbling Bryan. But to go through what they're learning. And I think that can happen in mental health and addictions. I don't know why it can't. It's not like we've got some patent that we can't give away or it's got all this value. This has value. This has purpose. How do we come together and say, let's learn from this? And whether it's local, Indianapolis, anybody, or Indiana, anywhere, that we put together our own ability to be the MD Anderson for behavioral health and addictions. I think we can do that. But it has to be taking ourselves and even our own organization and putting that to the side and say, this is what we want to do for Hoosiers. And I think we can do it, but it takes a lot of courage. It takes a lot of courage from anybody to say, geez, if I say something, will people just push me to the side? And I believe that happens at all levels of employees or leaders. So I hope I have given you at least my heart about what this is all about. What we do at Community, we can do better. And we'll continue to expand what we're doing. And people all the time say, well, can we afford this? We'll figure that out. And quite often, it's amazing how many people come forward to donate to what we do because it's them, it's personal, it's their way for getting back. So this isn't a name calling or anything else, and it's not trying to put anybody down. But I really believe that we have the ability to change our state. And the business of mental health will help change us in many, many ways. So thank you for allowing me to talk and share my passion for addictions and depression and family and loved ones. But the reality is, I'm no different than anybody else. And I need help too. And I have the courage to say, these are the things I'm not very good in. Can you help me? And to me, that's what we ought to be doing. So I'm glad to address any questions you might have, or maybe everybody went to sleep, I don't know. But it really, I announced my retirement here a few weeks ago. Hard to do. Like I said, never wanted to be in healthcare, but it'll be 41 years here really soon. And it's to fall into healthcare for all the things that I thought I might do in my life. This was not one of them. But to be a part of something in healthcare that is daily trying to help others is truly a godsend. So thank you all.
Does anybody? Okay, we have a question right here. I got you. Okay.
Thank you for being so genuine and sharing your story. When you think about the future of healthcare, in particular mental health, and you think about how much innovation is on the horizon now and we're doing things differently, do you see any new promising innovative practices in the area of mental health that the hospital is exercising or using right now?
Yeah, well, I guess two things there. One, I still go back to no matter what we have, whatever's out there, it's got to be safe to say, I need that help. That to me is our biggest takes us from saying, okay, hey, that's a good idea, let me go do it, and I refer back to cancer. I mean, who would ever think that I could personally name 10 people who had pancreatic cancer, and you wouldn't know it. They survived, and they've survived. I mean, that is unbelievable. But it's accepted. But there's all kinds of things going on. We've come a long way with medicines. We've come a long way with all kinds of other therapies that we can provide. But it's got to be something where people can raise their hand and they're not going to lose their job. They can raise their hand and they get time off to do that. They raise their hand and they have somebody who's there their go-to body that says we're going to get this done, that's still the impairment that I have, no matter how much we can do in the science piece of it. And I say that for two reasons. First of all, I'm not a scientist, so I really don't know all that. But the most important part of it is it has to be something that's good. It's not because you're weak. It's not because I'm tough. I have problems too. You know, why don't you suck them up like that? That kind of stuff is just, I mean, that's decades gone in so many places, but somehow it lingers on in this part of healthcare. Hey.
Hi. So, hang on. Thank you. Hi. Thank you for coming today. It's good to see you. So when what you've seen, if you were creating right now with the knowledge that you bring, what are some foundational aspects from a business perspective that you would want to see in place to create sustainable treatment programs for all the people who need this care, regardless of their ability to pay or to be insured?
Well, if I could wave a wand,
Yeah.
It would be in every orientation at every company that goes through and says there, we accept this, we accept, we know that people are going to have health issues. If you're going to have a child, you end up with cancer, you break your leg, you have mental concerns, you have an addiction. All those things are things that we're here to help you with. And I think that it has to have a grassroots thing, because you can't go to the top and have a problem and go down the other way. It really comes into the core of what we're all about. No matter what we're doing, what field we're in, we need people. I mean, there's all kinds of things going on with robots and AI, and we're the same way. But I'll just say the simple piece is there needs to be people involved with most everything we do. There's some things that can happen that, we have less people doing this or that, but by and large, we need people, workforce.
Bryan, thanks so much for being here today. Thanks for your leadership. Thanks for being a friend and a great colleague. I just really can't thank you enough. As a CEO of a major healthcare entity here in Indiana, there isn't an elephant but a woolly mammoth in the room, and that's the current political climate and how it's going to impact literally your ability to run a healthcare institution. We've got Medicaid cuts, and we know Medicaid is a big funder, in many cases the #1 funder of mental health services. We have cuts to public health in terms of our ability to do surveillance, to deploy harm reduction strategies for people with substance use disorder. The question I have for you is, what do you, from your CEO's office, see as the biggest threats to our ability to carry forth our mental health and substance misuse missions? And you're speaking to a room of business folks and of philanthropists. What can they do to address those big concerns, given that the federal government and, in many cases, the state governments are pulling back from previous support?
Yeah, that's I mean, for sure that this is going to happen. We're not going to change that. But that doesn't change my role and my responsibility. So it has to be to say, okay, how do we identify other places? And a lot of that would be charities or foundations and what have you, to say, how can we work together to find other ways to resource what we need? I can't say, okay, here's the math and it's going to be 1-to-1 or 2-to-1 or anything else. But it's like, okay, you sit in a position, I have a role, everybody has a role in what they're doing. Whining doesn't go anywhere. My mom taught me that. And but it is saying, okay, what are the things we're doing? Who are the people that we can reach out to? And how do we get more people educated on what we're dealing with for the purpose of workforce, the purpose of families, the purpose of, people having success in what they do? So those are the places, and I'm sure there'll be other places that come forward as well that have never been involved in this. And it's just one of these things that we can't give up or say, well, because of that, I can't help you. I just refuse to use that line.
Bryan, one of the issues that we often talk about as roundtable members is the need for workforce in the behavioral health space. As we talk more openly about this issue, people want to go get help, and then we need people to be able to care for them. Really am grateful for community's leadership in the behavioral health workforce development area. Can you speak a little bit about the initiatives that you guys have undertaken to meet that need?
There's a few, but the one that I would highlight the best would be just our behavioral health academy, where we're trying to treat people want to provide services to others, but they literally had to have 2 different degrees to do that, and that were costly. And we said, okay, how can we bring this together? And George Hurd's here somewhere. There you are, George. And he and other people worked with us to say, okay, how can we do this? And work with the local universities to say how we put this together. And the last thing I knew, from the number of people that we've been able to go through this program, I mean, you're up to, George, 60,000 plus people or something like that have received services, right? I mean, and so that doesn't mean we've got it licked or stopped, but what we can go through and say, okay, because education is what it is, and the changes in financing from the state or federal, that's what they are. Okay, we understand those things. So let's go through and find the solution, and many times can find somebody else that says, hey, I'll help you with that. That's a good idea. I mean, I'm always amazed at the number of people that come forward when something impacts somebody's life, the number of people who want to turn around and say, I want to help others. And I have the ability to do that. So it's a lot of programs, a lot of bureaucracies. If you looked at our district community, all the different programs we have for mental health and addictions, I mean, it'll challenge your brain trying to figure out how does all this work. Well, I wish we had an easy button to say we didn't have to do all these other things, but the issue is we have to go through and figure out what are we trying to do, how do we make sure we follow the regulations, and how do we fund it. And to say, okay, we can't afford it, that's never been something that I will say yes to.
Hello, thanks for being here. On one of the things you opened with, one of the things you said was, well, there's no money in it. And that seems to be, a lot of things I've looked into, that seems to be a big problem in terms of staffing, then also just of getting care in general. Do you have any thoughts on what could or should be done with that, other than going to charities, or is it just always going to be, oh, well, that's just what it is?
I mean, I'm not here to be negative to anybody, but if somebody has diagnosed with most any disease, there's a protocol to get this started with them, and it happens pretty quick. If you have behavioral health or substance abuse issues, that's typically a very long process, and that we can't wait until we get that approval. And I think, if I was going to create an AI bot to do something, we'll just do this for mental health and addictions, and we'll be a lot happier, and you don't have to spend any money on it. But the problem is it really goes through, and it changes by all kinds of different programs to do this, and we just have to have the fortitude to say, okay, let's understand this, how is it happening, and let's try to do the best we can. I mean, we I don't think I shared this, but we've been in the mental health and addictions. I talked about Fairbanks, but so we're opening a new campus in Westfield. We got a hospital underway right there, but we also will have 3 more behavioral health hospitals. We're building one in partnership with a company called LifePoint in Westfield. We're building another one in Greenwood, and we're also, and the company that we're joint venturing with, they have a place in Lafayette, and so we're assuming that as well. And what this is a company called LifePoint. And years ago, we had a rehabilitation hospital or wing called Hooks Rehab at the time. And due to a lot of issues, we decided that we were going to change that, and we found an organization that was building rehab hospitals. Never had heard of them. Next thing you know, we were building rehab hospitals. We got 3 rehab hospitals, inpatient rehab hospitals. This same company has gotten into the behavioral care business and the addictions. So we're working with them to do that in 3 other places. And I say that it's not because, oh, I know everything. No, we got to find people that can help us. We have people that are dependent upon that. We have people that have family, jobs, and everything else. Let's figure it out. And I don't think there's easy buttons in probably most places, but when you're dealing with people, we can't give up on people because it's really easy to do that. Plus, it's something that we need as well in our workforce, because a lot of people who go through things like this, they end up looking for jobs to give back, which is, part of their healing, part of their determination to change what they're doing. So, that may not be exactly what you're looking for, but it really is going through and let's do our research. Let's find this. You want to be in Indiana? Let's figure out how we do this. We started a residency. I've been doing this a long time. I didn't realize we were only producing 3 psychiatrists a year. And 1 or 2 of them went into research. Okay, that's fine. So we started our own, psychiatry residency. And then we started doing addictions fellowship. People look at me like I know what I'm talking about. I don't, but I got a bunch of geniuses around me. Hey, can we do this? And so it's really trying to figure out what's our problem and how do we fix that problem. And I don't want to give an appearance we can do anything. But when it comes to people and care and trying to help them through what they're doing, I think we should be able to do everything. And sometimes we partner with other hospital health systems as well, like the whole cancer thing. So it's really just trying to find, to have the perseverance to say, we're going to figure this out. And what happens, I believe, in our teams, they're just pleased to be a part of that. And I'm surrounded by a whole bunch of people that are really smart, as I said, smarter than me, and they typically come up with something. I'm like, that's a good idea. Let's go do that.
So
Vanessa?
I want to commend you for your passion and your kind of mission-driven approach. And given that we have this room of business leaders, as well as, I guess, where Jennifer and I sit from the Indiana Chamber and the Wellness Council perspective, we think about every day, how do we bring employers to this conversation around mental health, given its connection to workforce? And I might be teasing the next segment where we're going to talk about employer best practices, but you at Community deal with employers all the time in these issues and have a lot of kind of direct relationships there. So I'm curious if you can speak to any great examples of where employers have really leaned in and worked with you on these mental health challenges, because it might help some of us in the room.
Yeah, Vanessa, I would say, first of all, we can always be better partners. It's easy to start something, and the next thing you know, we get distracted and we go elsewhere. But, what we try to do is to say, okay, what are the issues? And to work with employers, to gather that data, to understand what's going on and trying to say, how do we put something together? I don't know that we've done that as best as we can. We're dealing with things in our door, or things in board members or at our boards or things like that. But I think collectively, there's a lot of things that we can do for employers related to mental health, substance abuse, getting this. And I just think I would start fresh on that, because I think we can do some things I don't think we've done as well as we could. Absolutely.
So, Bryan, I'm over here. I'm Susan Ryder, and I'm the president of the National Association of Benefit and Insurance Professionals. So we represent the broker space. And so I think for the employers in the room, collaborating with your broker, consultant, agent, whatever term you use for them, this is a great opportunity for all of us to really make an impact on healthcare policy, which when we enter it from the healthcare policy space, that's where we'll start seeing the difference on insurance coverage or other programs, in my opinion, because we can get the data all day long, but in order to advance the ability for consumers or employees to get access, healthcare policy also needs to change for mental health, in my opinion. Employers, I work with them on a regular basis. I work for a PEO now. I left the broker side. And so I work with a lot of small and mid-sized employers who don't have the budget for advanced mental health resources in their community. We were talking here at the table, there's a lot more chaplain type services that are happening across the state. That's one tool or resource in the book. Usually those are a little bit lower cost because they're faith-based. But there's this problem in the employer space, in my opinion, where they're unwilling in many cases, especially when they're smaller. Maybe it's because they're uncomfortable or whatever the scenario is, but they don't understand how rules and regulations actually give their employees down to 15 employees. ADA covers mental health as an example. And so there's opportunities through that, even though it's not a paid leave of absence to take care of their mental health, it's still a tool that protects the job for that employee. So I think all of us can be better stewards from an advocacy space to really drive healthcare policy. And I see Suzanne in the room. I know she does a lot with that. But it's really important for us to talk to our neighbors, talk to our friends. We know business owners, and we're all going to have to come together. And I appreciate everything that you do. I know we've had the opportunity to work together over the years off and on, and what you do to lead the charge is instrumental in our community.
Thank you. I will say one thing that I would say on that is if I could wave my wand and say do one thing, allow virtual conversations. We learned during COVID that worked. And we've learned as employers that it works. I will say it ticks me off when people won't put their camera on, but I'm trying to get over that. But bottom line, the idea of having that a resource, and I know there's all kinds of regulations and there's all these things on, but that to me is where I would start. Because that allows people to have the ability to get access when they need it, and to at least have evolved so we're not so far down the road that everything went bad before we could get to them. So I know that's not been in a lot of things. Virtual stuff we can't do anymore. I don't frankly understand why. So, and people can tell me all the regs, I still don't care.
Well, I really appreciated your talk. I'm Steve Boehm. I am a scientist. I don't know how many scientists there are in here, but with Indiana University. I am an addiction neuroscientist. I'll leave it there. We can talk about that later. But importantly, I'm the new executive director of the IU Institute for Human Health and Wellbeing. And one of the missions of that institute is to partner with organizations like Community Health Network and others in the space of mental health and addiction. And so I just wanted to publicly, to you and to everybody else here, invite you to contact me. Let's talk. Let's bring the power of IU research to bear on real issues in this space that you are having, and hey you, and see what we can do. And that includes in the area of AI and machine learning, and how we might bring that to bear. And I know that the answer is like, no, we can't do that. It's too dangerous. Well, we do the research. We try to figure out how to soften that, get to a place where maybe we can employ that to capture And I think you'll hear later about some opportunities that have been developed in that tech space, where AI and machine learning is concerned. So anyway, I'll leave it there.
Sure.
But
yeah, I'd love to talk to you about that, and thanks for sharing that. I also believe that there are the places in our country that are actually ahead of us doing things, and we've had some studies in the past, but then, and this isn't critical, it's just something bigger came along, and next thing you know, the group we had isn't doing what they're doing. But I think it does take a focus on it, an understanding, and get people in the room that can make decisions and say, okay, let's go try. I always said I was a baseball player, so, 4 out of 10 would make you the best there ever was. So, got to go up the plate.
Good morning. My name is Dr. Addie Angelov. I'm the founder and CEO of the Paramount Health Data Project. We're a small Indiana-based nonprofit. We pull health data out of schools. We actually started 10 years ago with a $30,000 contract from you. One of the schools on the east side of Indianapolis was overwhelming your ER, and we wanted to start looking at data to figure out what to do about that. But in addition to that little check that you gave us, you also personally wrote us a letter of support. And I need you to know that I shared that letter of support with anyone who would listen, and we were able to get so much more funding. We're now an established nonprofit. We serve schools from Clarksville to Gary. We have over 1 million data points on health and behavioral wellness out of schools in Indiana. I would argue primarily because you believed in us and you wrote us a letter personally. So I just wanted to tell you thank you, and that 10 years later, that one letter has made a huge difference to teachers, therapists, principals, students all across the state. So thank you for investing and believing in this work.
Thanks so much for reminding me of that. So thank you. But the other thing is, we're in schools, okay? So we're responsible for 30 schools for the health and well-being, and in 30 school districts. And you can imagine how much money we make on that. That's nothing. And we get some grant dollars here and there. But the issue is, we believe that kids need to be in school. I learned years ago in some conversations we were having in Indianapolis about this and that I know when my children went home, somebody was there with them. I also learned years ago that the third time that somebody goes home from school and there's not a parent there, the likelihood of them graduating plummets. Okay, let's fix that. So that's why we provide school nurses and mental health advisors and all these things so that teachers don't have to leave and students don't have to leave. My sister is an older sister. She makes sure I know that. But she's been a special ed teacher for years. And I remember her telling me, well, you finally did something that actually makes sense, Bryan, because I don't have to leave my kids because I can get my physical done or other things or my lab drawn at the school that she worked at. To me, those are the things you learned, and you say, okay, how do we spread it? And I just think that sometimes we get in our own box as opposed to say, okay, let's come together and look at how we change things versus just looking at ourselves. And sometimes people don't like the things we do, and that's unfortunate. But that doesn't mean we're going to stop doing what we're doing.
Mr. Mills, thank you very much for standing in your truth. I wish I had a boss like you.
You might not like that.
I'm going to present this question to you as someone with lived experience and also a mom of an addict. I loved your analogy of cancer and how we support individuals, we run to them, we support them with meal trees and things of that nature. But for us with boots on the ground, what is your suggestion or advice in making mental health and substance abuse disorders a more socially accepted illness?
That's a very difficult question. What I would start with is the fact that I have my times where I know I've got mental problems. I've got problems like, and it's, can I share that with other people to start the conversation? I mean, it's so easy to say, this is all good. I have got nothing. Oh, I worry about that person because it can't be. And so I think it really is trying to find people who really want to come together to change what we're doing and to say, okay, how do we learn? But I think it's finding groups of people come together and say, okay, we've got something we're working on, like we were talking about, that project is how do you come together? But people have got to feel safe because their career is on the line, their reputation is on the line. Oh, geez, I mean, how many times has somebody's kid ended up, in a hospital for whatever reason, or committed suicide? We should run to, not from. We're not trying to find the bad people. We're trying to say we all just need to be better to understand, because we put this facade on this as, oh, I got it all figured out. That's an absolute lie. I do not. But we can work with people, and when we have safe conversations, we can change the world. But we've got to be willing to do that. And also, just because it fails the first time or the second time, that's okay. We learn, right? We're researchers. We're people who go to try to make the world better. You learn from things that don't work, and you get on a different highway, or you bring in a different person that has a different perspective and say, this is how we're going to put it together. I just don't think there's an easy flip to it. It's just we got to figure out, how do we really become the best place in the country to work, to raise a family, to have success, to share, what are the things that actually get people through what they're doing, as opposed to pointing at these people and say, I'm giving up on you.
All right.
I'm done. Give me the hook.
Okay. Thank you. Yes, thank you. Thank you so much. Wow. Well, thank you, Bryan, for your motivating message. We certainly felt his passion from up here, and that was inspiring to me. So I want to say thank you for coaching your team and for working to address the stigma and having the courage to lead change. So thank you for that. Thank you for everyone who asked questions. And Steve, I'll be calling you for sure. Okay, I'm going to give you my card, and we have to talk. But we're going to take a short 15-minute break, and then we'll kick it off for our first panel discussion with Vanessa Green-Cinders, President and CEO of the Indiana Chamber. So take a few minutes to stretch, refill your coffee, and we'll see you back here at 10:15.